Hi, I am Jessica Thomas, Director of Patient Education for the NET Research Foundation, and I'm here for this month's Thrivership series. And I would like to talk about something that I'm very passionate about. As a licensed clinical social worker, I've worked with many patients that have been living with chronic disease or progressive disease and sometimes terminal disease. And there's often a crossover of emotional distress and feelings of anxiety, sometimes depression or mood changes when you're living with a chronic, progressive, or sometimes terminal disease. And so in cancer thrivership, it is very common to experience some aspects of anxiety. So I'm going to focus a little bit on anxiety today. So anxiety is something that can be very uncomfortable. Often when we are diagnosed with a disease or living with a disease, it can ebb and flow to have feelings and symptoms of anxiety. It's something that you should talk with your healthcare provider about if you're experiencing, and it definitely if it is affecting your sleep and your quality of life. I like to think of anxiety sort of as something that sometimes can come into waves. So for example, when you were younger, you might have went to the ocean on a trip, and you were probably playing in the water, and all of a sudden a wave came, and it might have taken you off of your feet and kind of took you to the shore. And it was fun. Sometimes I feel like uncontrolled anxiety feels like that it comes and it picks us up and it kind of takes control a little bit. Now, when you were at the beach, we'll go back to that visit, there was probably a time that you realized that if you planted your feet into the sand, that the wave could come and you could jump it. And therefore, the wave could still be there, could still happen, and you could experience it differently. So often I think that when we're thinking about anxiety, it's okay. It's something that might feel uncomfortable, but negative emotions are okay. One of the primary things that we should do is work on accepting and acknowledging that. Oh, this is anxiety happening. This feels kind of uncomfortable. I don't like it, but I understand it. And then applying our values. I know for me, I want to continue to do things regardless of being in the face of anxiety sometimes. So what is it that you want to do? Well, I realize I feel uncomfortable, but I know that I want to continue to comply with my treatment, or I know I need to talk with the doctor to get more information, etc. And then essentially you go by what your values are. And that leads your behavior. So even though you might feel anxious and you might feel uncomfortable, your values really lead your behavior as you work through it. Anxiety can be crippling at times. And if you're dealing with a lot of it, I do want you to talk with your healthcare provider. However, I want you to know that it's also a normal thing that you can experience during cancer survivorship. And it's important to find strategies, tools, and resources that can help you when you feel that wave of anxiety coming up. So for this month's Thrivership series, I hope that you can read the article that I attached to this and learn a couple of tools or resources that you might identify with, and know that if you experience anxiety sometimes, that it can be normal. I'll see you next month at our next Thrivership series. If you have any questions, you can email me as well. Thank you so much.